Women have historically been treated lesser and do not experience the same rights as men. Worldwide, women and girls continue to encounter violence, discrimination, sexism, and harmful traditional practices, fighting in an endless battle for gender equality in a society in which men hold the position of power and privilege. Immigrant and visible minority women are the most marginalized and stand at an intersection in which they experience multiple systems of oppression. The following video contains potentially sensitive subject matter as we explore the fight against intersectional stigma and its link to women from communities that practice female genital mutilation or cutting.
FGM destroyed my mother's life as she was never able to have a happy marriage. The practice deprived her of interacting and feeling intimacy with my father. She was explaining to me how this practice turned her into an emotionless creature rather than a human being. It is catastrophic that people still think about this practice that kills all the natural and true feelings of the woman.
In some African, Middle Eastern, Asian, and Latin American countries, women and girls undergo a harmful practice that is a violation of their fundamental human rights. A practice embedded in gender inequality and used as a means to control their bodies and sexuality.
I can remember very well when I was 9 years old, when the ladies of the family gathered at my grandmother's house, and 2 cousins and I, aged 7 to 9, were circumcised. I remember very well the pain, shock, and lack of understanding of what is happening to us and why. And when I asked my mother why this happened to me, she said this is the prevailing custom for all the daughters of the family. And this happened to me also when I was your age. Female circumcision is nothing but custom and social traditions that have no justification other than that it is a way to raise girls properly and limit their desires from establishing illegal relationships before marriage, ignoring that its impact also extends beyond marriage. This is why I and many girls suffered from problems during sexual relations with husbands.
Female genital mutilation or cutting, FGMC, is the partial or total removal of the external female genitalia or other injuries to female genital organs that are completed for non-medical reasons.
Female genital mutilation is a harmful practice affecting millions of girls and women across the world. About 200 million women and girls globally are living with female genital mutilation, and 3 million more undergo this unacceptable act every year.
As a survivor, I can describe FGMC as a useless practice that only brings harm. And the first thought that comes to my mind when I think of FGMC is that it does not bring any health benefits or harms girls and women in many ways. I remembered that FGMC impacted me immediately after performing this practice. I felt pain, urination problems, and shock.
Female genital mutilation has no health benefits, and it harms girls and women in many ways. Procedures can cause severe bleeding and problems urinating, and later infection as well as complication in childbirth and increased risk of newborn deaths.
As FGMC is deeply rooted in culture, traditions, and identity, families find it difficult to abandon the harmful practice out of fear of social exclusion and judgment by their community.
ባህል ብለው ይዘውት ነው ሪሊ እውነተኛው የሃይማኖት ብቻ አይደለም የባህል ሂደት ነው አልኩሽ እኮ መስለው ለመኖርም የሚያደርጉት አለ እንደነገርኩሽ አንድ ትንሽ ነገር ወስደን በቃ ተገርዛለች እንበል ተገርዟል እንበል ተብሎት ይሄ ሜካፕ ስቶሪም ቢሆንም መቼም መስለው ለመኖር ግን አድርገውታል
With an increase in global migration to Europe and North America, the issue of FGMC can no longer be isolated to countries where the practice is documented, as a sizable number of survivors and girls at risk are among their immigrant populations.
A CBC News investigation has revealed 1 in 6 female asylum seekers in Canada is fleeing domestic violence, forced marriages, or female genital mutilation. Half of them say they're escaping abusive partners or family members. The Immigration and Refugee Board heard nearly 3,000 domestic violence-related refugee claims between 2013 and 2017. Almost 60% were accepted.
FGMC is often overlooked as a Canadian issue, but unofficial statistics place the number of survivors in the country at about 100,000 women. In 1994, Canada was the first Western country to grant refugee status on the grounds of FGMC. And in May 1997, Section 268 of the Criminal Code was amended to include the performance or aiding the performance of FGMC as an aggravated assault, punishable by up to 14 years of imprisonment.
When I gave birth to a girl, all that was on my mind was that I did not allow her to have female genital mutilation. My immigration to Canada was the best way to keep my daughter from FGM. After I found out that it was added to Canada's criminal law. It can't just be about criminalization and citizenship. The country needs to focus its efforts on improving support for survivors and families, as well as improving education about FGM in Canada. Professionals and educators need to be trained to deal with it when it is reported or discovered.
Outside of a legal response, Canada has made the pledge to support global efforts to end FGMC practice through financial contributions. But the country does not do much for the survivors who immigrate here and the girls at risk who flee for their safety through the refugee program. Organizations such as Women's Health in Women's Hands Community Health Centre and GenderNet Plus are supporting women and girls in Canada affected by FGMC by advocating against gender-based violence and providing valuable resources focused on quality of care and prevention. But this is not enough, and Canada needs to do more to make support services and resources more available for women and girls from FGMC practicing communities.
Yeah. First, I would say, I would just use the state, as broad as that might be. We need the will, the political will to say we care. We care about everybody coming to this space because we welcome, that's a commitment we make. So we care. And based on that, there would be resources, right? The resources might include having to have medical practitioners learning about these things, getting to know about female genital mutilation, getting to know the ways of helping women, of course, in consultation with the people that experience it. But there must be a political will out there.
Understanding the challenge. Unfortunately, FGMC survivors often experience stigma. Stigma is the negative attitudes or discrimination against someone based on distinguishing characteristics such as gender, race, sexuality, or health status. Stigma can create a barrier to accessing needed support and resources, and it is an issue that greatly impacts the health and well-being of FGMC survivors and other marginalized populations here in Canada.
It seems that oppressed people of color experience more forms of stigma, which makes it harder for us to live and function in everyday life. Women of color can experience stigma intersectionally. It denotes the overlapping effect which has produced systems of oppression of stigmatized identities.
When an individual or group experiences multiple forms of stigma that overlap, this is known as intersectional stigma. Individuals from FGMC practicing communities are an example of a diverse group with many intersecting identities, experiences, and needs. How does intersectional stigma look for FGMC survivors? First, FGMC survivors are women. They might experience discrimination in employment and leadership roles. They may have demeaning media representation and feel objectified. They're also immigrants and racial minorities. They might encounter hate crimes and assaults, racial slurs, and discrimination in education, criminal justice, and housing sectors. Women affected by FGMC might be asylum seekers or refugees. They may fear social and institutional exclusion, ineligibility to services and resources, exploitation and backlash for receiving government financial assistance. They may identify as LGBTQ2+. They may experience rejection and exclusion from family, peers, and community, and face assumptions of their sexual orientation or gender identity. FGMC survivors navigate trauma and mental illness. They often experience distrust and physical avoidance from others. They may face barriers to receiving appropriate care and resources, and experience negative views and attitudes towards their condition.
And now, as you continue on your healing journey, there are even more layers to the trauma and everything. That can be very brutal on the individual. So I wish this would be something that Canadians could understand.
Overlapping within all of these identities is discrimination in employment, limited and Eurocentric training of service providers, and insufficient tailored health information, resources, and services. What is the impact of intersectional stigma for FGMC survivors? Intersectional stigma has been linked to adverse physical and mental health outcomes, chronic stress, poor coping responses, health-harming behaviors, self-isolation, and socioeconomic consequences. For survivors, the fear of being stigmatized and discriminated against discourages them from seeking health services for FGMC-related health problems. Reluctance is often driven by the possibility of culturally insensitive care, judgmental attitudes, and negative reactions by health providers.
Navigating pregnancy and childbirth was the hardest part. I felt like I had to battle everyone, my family, my OBGYN, nurses, CAS, you name it. Everything from whether or not I could become pregnant, how I'll have my babies, and if I could take care of them came into question because of FGC. People accused my husband of being abusive. I can't imagine that if he really were, I would feel safe enough to tell doctors, social workers, and nurses who were not listening to me about anything.
20 years ago, this was her experience, and she said while birthing during the delivery room, she was completely shamed and ostracized. She said when they saw she was circumcised, they didn't speak with her, they spoke at her, and they called staff and additional staff, nurses and other doctors to come and see while she's there laying. And there was no conversation with her, it was all very medically ran, and she felt very, very, very small, and she was very, very hurt. Very, very, very hurt. That was a very painful experience on top of just the pain of and trauma of just childbirth. Now, she said she never understood why there were so many people even observing her.
The fight against stigma cannot succeed without using an intersectional lens to understand and address health inequities among marginalized groups, concentrating on the structures and systems that drive stigma and discrimination. How do we address intersectional stigma? Intersectionality is a framework for understanding the interconnection between social categories and systems.
Many years ago, I began to use the term intersectionality to deal with the fact that many of our social justice problems like racism and sexism are often overlapping, creating multiple levels of social injustice.
A clear understanding of intersectional stigma and how it manifests in people's daily lives is the first step in combating it. Several health-related research studies and literature have centered on intersectional stigma experienced by marginalized groups in Canada. Health research began applying intersectionality theory to address the disparities experienced by people from marginalized populations living with or at risk of HIV. Although HIV-related stigma is a major barrier to prevention, treatment, and support, service providers and advocates recognize that stigma and discrimination related to other social identities also contribute to HIV infection vulnerability. Using an intersectional approach ensures the development of effective HIV programs that address the multiple social determinants of health and respond to systemic and structural health inequities.
Increasing knowledge, community awareness, training, and education are great ways to challenge stigma and discrimination in Canada. With the government's help, appropriate resources can be beneficial to those who are survivors, as well as to the rest who need to understand the nature of the issues, consequences, and overcoming those challenges.
In 2019, Canada's Chief Public Health Officer released the annual report on the state of public health, which highlighted stigma as a driver of health inequalities. The report acknowledged the common practice of discrimination and judgment based on health conditions such as mental illness, HIV, and substance abuse. Stigma against those with health conditions cannot be tackled until stigma related to other identities such as race and sexual orientation is considered. Ending stigma and promoting inclusion requires a comprehensive approach involving system-wide initiatives in education, training, practice, and policy. We need to discard old policies and practices that are inefficient to the needs of marginalized groups. Health practices should be built on cultural sensitivity, and trauma and violence-informed approaches should be incorporated into the delivery of services. Most importantly, the development of health policies and programs requires collaboration between health sector leaders and members of marginalized groups. Researchers can do their part by filling the gaps in the national data and knowledge on diverse populations' health status and their stigma experiences.
Communities experiencing intersectional stigma are in the position to identify and facilitate effective interventions to address intersectional stigma. As such, the development and implementation of interventions to address intersectional stigma should include leadership and engagement of communities experiencing the type of intersectional stigma. For example, working with peer navigators, women can acquire critical skills and tools to manage and address anticipated and enacted stigma experienced when seeking services.
What else can we do? Stigma can also be challenged at the individual and community levels. Individuals can make a difference by abandoning harmful labels, challenging myths and stereotypes, being self-aware of negative attitudes and behaviors, and committing to ongoing learning. Community organizations can lead initiatives and activities which advocate for marginalized population groups, raise awareness of the impact of stigma, and offer resources and services to address their needs.
I think it's really important for medical providers not to use terminologies that shame. Like in explaining, in conveying the messaging, I think the more you use terminology that is aggressive, the more the patient sinks into shame. If you say, that's a barbaric procedure, or I'm just saying the way you even have the engagement of the conversation will play a role on how it re-traumatizes the women. And I think language is excessively important.
Here's what Women's Health in Women's Hands is doing. Inclusivity is a commitment Women's Health in Women's Hands has made in addressing the issue of access to healthcare for racialized women in the Greater Toronto Area. They have conducted research studies focused on intersectional stigma experienced by HIV-positive African, Caribbean, and Black women, and have partnered with community organizations to develop stigma reduction interventions. As a result of the experience and knowledge gained from these activities, they have created supportive resources for FGMC survivors who go through similar experiences of intersectional stigma. Women's Health in Women's Hands Fight Against FGMC began through advocacy work in 1990 by health promoter Hawa Muhammad, who designed and developed the first FGM workshop in Canada. The organization also played an instrumental role in establishing the Provincial Interministerial Task Force on FGMC in the late 1990s. Women's Health in Women's Hands launched Flourish, a collaborative community-based project to engage, empower, and support women affected by FGMC. The project raises awareness of FGMC and advocates with survivors to address the practices as part of a spectrum of gender-based violence. Most importantly, Flourish collaborates with survivors to meet the unique needs of those affected by FGMC.
The Flourish project is an important way to get involved, as this project aims to address the intersectional stigma that women face, particularly women of color who are FGMC survivors. Therefore, becoming part of the Flourish project is a great way that stigma and discrimination can be challenged at the communal level. The Flourish project is a form of community leadership and engagement, which has public health researchers and practitioners connecting and forming mutual partnerships.
To help reduce the stigma surrounding FGMC, the Flourish Project initiated a digital storytelling initiative that offered a safe space for survivors of FGMC to share, reflect, and give insight into their experiences. Their narratives challenge the dehumanizing and racist undertones of FGMC practice in the media and educate, inform, and inspire positive social change. What's next? Stigma reduction cannot be fully achieved without centering the structures and systems that drive them. Understanding how stigma and discrimination relates to different social identities will help with developing and implementing health promotion initiatives that apply stigma reduction interventions.
Intersectional stigma and discrimination interventions must happen beyond an emphasis on individual attributes by including ideas that both seek to dismantle the systems of privilege and power that drive intersectional stigma and as well as mitigate the harms caused by those systems.
In partnership with the RHC for FGC Gendered Net Plus project, Women's Health in Women's Hands will strengthen support systems for FGMC survivors, improve the practice of service providers who support them, and continue addressing systemic intersectional stigma. But we will only achieve this by listening to their stories, engaging with them, and involving them in the development of community initiatives through the Flourish project.
Listen to survivors. Do not speak for them. Lift up their voices. Survivors know what they need. Don't assume anything about the identity of survivors or what their relationship to their community or their experience of FGMC is like. Be humble. It's okay not to know. It's not okay to judge and shame survivors without accountability.
የነሱ ፎት አይደለም የነሱ ስህተት አይደለም ይሄ ቢሆንም ቢያዩም ለምን ተደረገ ለሚለው ጥያቄ እነዚህ ልጆች መልስ ሊሰጡበት አይችሉም ለምን በህፃንነታቸው ነው ነገር የሚያገኙት የዚህ ጥያቄ ዋጋ ከፋይ አይደለም እውነት ለመናገር ወላጆቻቸው ነው ያ ካልቸራችን ነው ባህላችን ነው ብለው ነው የሚሏቸው እነዚህ ሰዎች even if it's happen ቢደረግም ቢደርስባቸውም አይዟቸው የምንችለውን እርዳታ በምንችለው መንገድ እንወስዳለን ይሄ የእናንተ ስህተት አይደለም ልታፍሩበት አይገባችሁም ብሎ ማጽናናት ነው እኔ እንደሚመስለኝ